don't even have to, just the 360. Yeah. For the head to toe assessment. Terry will be our camera operator. So everything should be good and we can get closer if we need to during certain things.
And you just might hear one of our other classmates, Mason, come in.
Mason?
Madison.
Okay.
Sorry, Madison might be coming
I'll just
in.
walk out here quick. Here.
Oh, goodbye.
I don't know where I said Mason.
Hello.
Oh.
I am Ben, your student nurse, right, for hand hygiene. Can you tell me your name and the date of birth while I provide for privacy?
Annie Foster, 10/22, 2004.
Okay, I'm gonna look at your ID band. That's great. Can you tell me any allergies you might have?
None.
No allergies?
Nope.
So I'm just looking to look at provider order, and this is just a head to toe assessment. So we're going through all my majorly bodily parts and structures and functions and everything like that. So it's gonna be a lot of fun. Woohoo! Oh, there's our friend person. Then, so today I'm just gonna ask if you're in a comfortable position.
Yep.
Okay, and we're gonna be moving up and out through the procedure. I have to ask you a couple questions. I've already gathered my equipment. I'm gonna have to cleanse it, but you get it. Then, just 3 questions I'm gonna ask. Do you have any concerns today?
Nope.
Do you have any? Have you had any surgeries ever?
Nope.
Have you had any major injuries in the
Nope.
past 6 months? Are you feeling sick today?
Nope.
Okay. Do you have any pain? No, that's a 0. But I would use old cards if you did. I'm gonna just come over here, just cleanse some of my equipment. This is just so we're not spreading infection around. Can you see me? Yes, you can. This is my little light pen. Probably didn't have an issue with that. I can already tell. Karen, can you just show them the med cart, please? I just don't want them to have a problem with that. Oh, wait, that's down. Yeah. Show the med cart. You don't need her to have any problems with that. Can you just quick smell this before I throw it away?
Yep, smells like alcohol.
Can you pinch the other nose?
Alcohol?
Okay, can you pinch them?
Alcohol?
Yep, okay. That was your olfactory nerve test. I just decided to do that quick. Just to get it out of the way. So do you know who you are, where you are? And why you're here?
I am at Southwest Tech. It is October 9th or 10th. And I am here for a head to toe assessment.
Okay, that's great. That's all great. So we're gonna start taking your vitals, so. You might go to your other wrist. No, I got it here. Okay, so that was 70.
All right.
Okay, now we're gonna do respirations. Okay, and we're gonna begin. So that was 7. I did 30 seconds for each. So that's all good. Now we're going to take your temperature. And we'll do a blood pressure. Okay. Just under your tongue. 98.3.
All right. Well,
14, 98.3. 78. Write this down now. I'm gonna mark this down. This down, marking it down so I don't forget it. 23 Fahrenheit, 14 rest, and 70 pulse. Then I gotta take your blood pressure. Oh, let's take your blood pressure. Which arm do you want to be? That arm, okay. So this is our blood pressure thing. And I didn't, when you were breathing out, I didn't notice any retractions. You had a good rate and equal rhythm. Here, see this? Yes, let's make sure I'm doing this right. Here, I'm gonna check this for sizing. It's sized right. Can you rotate your arm more? Thank you so much. And we're just gonna do this. So I'm gonna feel that. Make sure this is in all the way. Okay, we're gonna be going up to about 160 next time. I'll give you a little minute for everything to deflate and go back to normal. I'm gonna just go grab my stethoscope. So during this, I asked you if you're ANO, you know where you are. Been feeling all right normally?
Yep.
Okay, lately normally, yeah. You know, we're gonna do your posture. And I'm gonna note your mood, your facial expression. This is all normal. You seem fine. I'm not noticing any foul odors. So you're not like swelling yourself and you don't have any issues and you're smiling. You want to show the camera your smile. See, she's smiling.
Mm-hmm.
Okay. Also gonna have to know the blood pressure category. And then check your posture. I'm gonna use the book. Oh, that was all great. That was all. Here, I'll get this off you. Later pull. Yes, it is. That was 120, or excuse, yeah, 120 over 62. So normal category. You're so close to that perfect measure of 120 over 68, which will begin my noting of the categories. So what this means, what everything, all the categories are, is there is a normal category of 120 or under. Then there is an elevated stage, or excuse me, 120 and over 180 and under that for both the systolic and diastolic would be considered normal. Then cleaning that off, then the elevated, your diastolic still has to be under 80, and your systolic can rise to 120 over 129. Then, I'm going to throw this away. Then it's 130 to 139 and 80 to 90 for stage 1, and then 140 to 180 would be stage 2, and then over that for the diastolic, the 40 to 80 would be stage 2 for the diastolic. Then there's a hypertensive crisis, which is over 180 and 180 for both. So can you stand up? I just got to look at your posture. You can turn this way if you want. I just got to look at your back. Sorry, I'm looking for scoliosis, kyphosis, and lordosis, which you have none of. Your posture looks great. I looked at your mood and all that. So you can sit back down if you would like. I already looked at your facial expression, notice your consciousness. So now it is time to move on to your head, which will be one.
On this side.
It's so whatever. I can come over there. I just gotta write my. Excuse me. I gotta write down my BP. Okay, we can come over here so we're closer to the video. Hello, I'm back. You can sit up. So we're gonna begin your head. So I'm looking for shape, size, and symmetry of the head, which is all good. There is no abnormalities at all. Then I'm also gonna palpate for any masses or any tenderness. You feel anything abnormal?
Nope.
Okay, can you give me a big smile? Okay, I'm looking to see for a nerve that the smile is good, yes. And then I also have to gonna do just a light test. If you could you feel all that?
Yep, I could.
Okay, that's great. I'm just gonna while I'm here, just gonna palpate your frontal sinuses, maxillary sinuses. No tenderness there.
Nope.
Okay. So I got all that done out of the way. I believe that is it for your head. Then I am now moving on to your skin system. I'll just get there. I'll get there right now. So I gotta check the skin warmth, the temperature, which it is warm. I gotta also test your turgor, which went back immediately, and your texture was nice. Your skin's soft, so nothing there. Let's see this. Let's move this. We're gonna check your hands and your feet. I'm just looking at your hands and your nails and your feet for any abnormalities in color, if there are lesions on any of these. I'm also looking at the shape and size of nails for like clubbing or anything like that. And while I'm here, I'll just get capillary refill out of the way, which is that's all normal. I'll also come back over here this way. I gotta go back and I'm going to check for. I gotta check on the back here for lesions or anything like that, which there are none of. Especially with this robe or this gown. And I'm going to use the ABCDE mnemonic to check for that. Come back over here. Follow me. Right here. Okay, and then I'm also looking at your color and skin complexion, which is all normal, so no cyanosis or pallor or anything like that. That should be it for the skin. Then I'm going to move on to your eyes now. There are a couple tests, but right now I'm going to look at your pupils. So their shape is normal, they're symmetrical, and they're black. And then I'm looking at your irises. They're like a hazel color, their shape is normal, and they're symmetrical. Your sclera, it's white, and there are no lesions. Can you pull down, please?
Mm-hmm.
It's pink and moist. And then can you just blink a little bit? I'm looking for lesions, edema, or lid leg. I'm also going to palpate the structures and then I can do my test. So, feel normal tenderness in your pain?
Nope.
Being very gentle. I got to grab a pen right here. Okay, we'll just go pupil dilation first. Woo. Okay, that works. We're also going to have you do the cardinal directions. So up, back, down, up, over, back, up, down, excuse me, up again, down, back, down. We're also going to just follow in your pupil area response. Okay, you're deconstructed when exposed to more light, so that's all good. Now I have, I have a word right here on my pen. Can you see that? I have there. And can you tell me what it says?
Pupil gauge.
Yes, that is correct. So that should be everything for the eyes. We're gonna have you flip back over on the other side. And this way, can you show me back this up? Come with me, camera. A lot of walking around today. Now I'm gonna just look at we're gonna assess your ears. Ooh, so lots of movement.
This,
Yeah, not a big deal. Okay, so I'm gonna look and inspect for any drainage, excess cerumen, foreign bodies, any signs of infection around the ear, drainage, shape, and size and color, which is all normal. I'm gonna fold forward. When I'm palpitating, do you feel any tenderness?
nope.
I don't feel anything over your menstrual process now. Does that feel any abnormalities there?
Nope.
Okay, so I'll go for the otoscope. I'd pull up and back for a child, or an adult, excuse me, and down and back for a child. So I'm just gonna look for any signs of redness or any other signs of infection, which there aren't any. I could see that pearly gray flat tympanic membrane, and that's great. No signs of infection. And same thing on this other ear. It's pearly gray, that silver light color. And there was no signs of an infection or anything like that. And I palpated again all your ear structure. So that should be good for your ear. Now it is time for your nose. Oh, I almost forgot your whisper test. I have to come back behind you again.
1, 2, 3, 4.
Okay, so let's type. See.
ABC.
Okay, that's great. Follow me, camera. Follow me. Right here, camera. Okay, I'm back. It is good. Or no, I just did your eyes. It's nose time. I'll look for my pencil here. Okay, first I'm going to note the color, shape, size of the nose, and if there are any lesions on there. There are not any of those. Now I'm going to look into the nose, if you can tilt your head back, for any lesions, deviated septums, any foreign bodies or anything in there. And there are no abnormalities. Everything's clear with your nose. I already palpated the frontal and maxillary sinuses, so I'll just do the external structure. Does that seem okay?
Mm-hmm.
Okay, that's great. Now, can you open your mouth? I'm also going to look at the lips for color, dryness, lesions, and cracks, which are none, and your color is normal. So your buccal mucosa, this is pink and moist. Can you go like this? I gotta just check for any signs of gum retraction or bleeding or anything that'd be in there, like edema or anything like that, which there are. Your gums look fine and of normal health. So, can you open your mouth again? I'm gonna check your tonsils for exudate and their size, which is normal. And can you just go, I checked your uveal mobility. So I checked that. Then can you stick your tongue out? I'm checking for if there are any lesions on there, if it's normal color, and if it is Medline, it is. Can you say light tight dynamite?
Light type dynamite.
Okay, that's great. Then I'm just gonna take a look under your tongue for color and normal, and that should be it for your mouth. Next, we're gonna just move down to your neck. So I'm assessing for shape, symmetry, which there is. And can you just move around, like extend, just go through all the range of motions in your neck. I'm assessing for range of motion. Then you can sit down or lay back, or we'll lay back. You'll see me. Yes. Can you turn your head this way towards me? And then back. I'm just assessing for jugular vein distension. I'm gonna palpate the carotid arteries one at a time. Okay, that's normal. And it is equal on both sides, which is great. Now I have to use my stethoscope here. And I'm going to have to assess these arteries using the bell. Not this. I'm assessing for bruise, but I'm not gonna. Okay, can you turn your head? You can breathe in and out now. And okay, all great. I don't hear anything abnormal in there, which is all Oh, great. So we're gonna move down to your chest area now. We're gonna start with your thoracic. Put your knees down. Because you're gonna have to sit up for this. I'm gonna be assessing all the spots throughout your body. So we'll start with that. 'Cause that's what I know. Uh, yeah. Okay. We'll just start doing the follow here. Bronchiovascular, and vascular. So we're gonna start on one side and I'll hop to the other. I'll start over here. Mhm. Okay. This side. So have you breathe in. I'll go down. Breathe in again. Come back over here. Can you breathe in? Okay. And now we're gonna do your front. So you can turn and face me. Just gotta listen to those 10 spots. You see? Yeah, sorta. Okay. Okay. First, breathe. 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 No. Oh. And you might have to lift now, move your gown and adjust your gown up.
Nope.
I'm gonna move it down more. Okay. Let's go back to this side. Get up there. Okay. So everything was normal and I didn't hear anything. Then I'm also going to look at, so I noted earlier why I did your respirations that I did not see any retractions, use of accessory muscles when you were breathing. There's also normal rate and it's equal, so not anything unequal expansion. Next, I have to check your ratio. This will check if you have chest, which is a 2-to-1 ratio. I'm also gonna have you stand up.
Yep.
Just you gotta breathe out or in and out, excuse me. Then say 99.
99, 99, 99.
Okay, if you can sit down now, we'll move to your cardiac. So we're gonna start. You can So no. I got to check. I'm going to check. Like, I gotta see if you adjust this. I have to check if you have any deformities on your precordium, and I have to know that that's one's going to be here, best heard, and the aortic and pulmonic valves, and your tricuspid and mitral is best heard. Your S2 is that. So you don't have any deformities. I'll also have to check, do your apical heart rate, and then I'm going to go through each one twice to assess for your ape to man. And I'll also just palpate. Just tell me if you have any tenderness.
Nope.
Okay, all good.
I'm moving on the other
See
side.
everything? Yeah, just get on this side. Thank you. Well, that's your first. It's in 8 seconds. They sort of see that? Okay. I palpated. This is your second intercostal space. And I'm hearing a nice beat. Now moving over here to your second intercostal space on the left side for your pulmonic. Nice, strong. I gotta move down to Herb's Point. Okay. Can you like adjust this on this side so I can get to your mid clavicular line on the fifth intercostal space? So can you like lift up and everything so I can get right under here? Okay. I got 71 beats per minute for your apical pulse, which is all good. Now I'm also gonna have to go back through with ape to man, just using the bell to assess for any brutes. Then I'll be then I also have to go through your peripheral pulses and all that fun stuff. Same thing on that one. You're gonna lift and pull up. You can see where I was. Yeah. I'm hearing nothing, which is a sign because I'm using my bell, and then it'll assess per brutes. So now I get to assess your peripheral pulses for or if they're equal bilaterally. So that was equal bilaterally, symmetrical, everything like that. It's not bounding or anything. Assess your pulses. That's equal. Can you come like adjust the camera, please? Thank you. You can see that. So just point it down there more. I would also note your femoral. So we're not going to do that. I'm going to come down here to your feet. Can you? Equal. I'll just come back down here. You see that? Okay, that's good. And then can you like Oh, your pants. Well, I might have to do this through the clothing.
Yeah, my fans are not gonna.
Yeah, they're not gonna come up. Okay, I'll just.
But if they did,
Yeah. I'm also gonna note they'd start noting the edema scale, so zero's no edema. Then there's minimal traces. Then there's graded 1, 2, 3, and 4, which is that's all good. That's equal. All your things were equal, symmetric or bilaterally. There's no bounding pulses. So your edema scale is grade 1, 2, 3, and 4. 2 millimeters, 4 millimeters, 6 millimeters, 8 millimeters. 2 millimeters disappears rapidly. Then 4 millimeters disappears 10 to 15 seconds. Then 6 millimeters disappears in about a minute. Then 8 millimeters disappears in 2 to 3 minutes. So I'm actually going to palpate for edema now, like surrounding the ankle areas. Look for the hands and the arms. No, I don't see any edema present. So I think I'm safe to move on. Now move on to your abdominal assessment. And then we'll just have after that, we'll have your muscular system and then your joints and range of motion, then your neurologic, and I'll get your lymph nodes with that.
no.
Then, can you also slightly bend your knees? I think they'll be able to see that. Okay, first I'm gonna inspect, look for striates, lesions, scars. I'm gonna note any hair distribution, and I'm not seeing anything that's indicated with any injuries or any infections, and I see no scars. Starting at the right lower quadrant. And I'm slowly going up and around. So far, I'm hearing just normal sounds. So, nothing hypoactive or hyperactive. And I just made it back. So, we're also going to check your aortic artery for Brutes and about your renal. And then your iliac. Be about down here. Nothing. And then I'm going to lightly palpate for bladder distension, surface characteristics, mass, tenderness. You tell me if you have any pain. And start right lower quadrant too. Just tell me throughout if you have any pain.
Nope.
No?
Nope, no pain.
Okay, while I'm doing here, I'm just going to ask you a question. I'm going to tell you 3 words and then you repeat them back to me. Can you tell me blue sock bed?
Blue sock bed?
Okay, you can put that down. Did you feel any pain?
Nope.
Okay, what were those 3 words I just told you?
Blue sock bed?
And who is your teacher in 2nd grade?
Miss Brandt.
Okay, that's all great. So I'll set you up now. We'll just get right to your lymph nodes and then your muscles. Okay. Also range of motion. So I gotta check here your pre-auricular. Can you tilt your head up? Your submandibular ones, then your submental ones, your supraclavicular. On each side, you have superficial clavicular, or cervical, excuse me. Then can you tilt forward? You got your occipital back here, and then your posterior cervical. Can you turn your head? I'm just gonna assess for your deep cervical on each side, which is all good. So we did your neurologic, your system. Now we're gonna move on to your quick move on to your muscles. Okay, so let's. Do you want to stand up or sit on the what?
That's it.
Yeah, it's this side. They're just. They should be able to see. So, can you turn your head this way? This way. Okay. Can you do it again with resistance? And I'll just start getting bilateral hand grips. Also just start doing the joints along with the muscles. Paul. Okay, you're doing her bilateral hand grips so you can see it. pull. Okay, you got good grip strength. Your muscle scale is 5 is strong, 4 is a little weak, 3 is weak, and 2 is severe range of motion impairment, and 1 is severe weakness, and then 0 is paralysis. So can you open and close your jaw? Okay. So I'll palpate the TMJ. Do you guys want to move this camera back over here? Or to at least where they can see I'm doing that. So just turn your head there. So yes, I did an inspection palpation of that. I think you can see it now. Now we'll move to your cervical. I think they can see that. Can you flex your head down, then back, then laterally tilt it, and then rotate a little bit. Okay, go through all those again. My hand is under here. Okay, we're gonna flex it down. Okay, great. So we'll just go through a range of motion and joints with those, and if I forget anything, I'll come back. So shrug your shoulders. Okay, that's great. You want to stand up? We'll just do your deltoids right now. So feel goal post. Okay, so can you press up? Go down. Press back up. Go down. Put your arms to the side, and we'll do shoulder flexion, which is out. Extension, which is back. Your internal and external rotation, then your abduction and adduction. And we'll have you go through all those. Okay. I did not notice any pops or anything like that. So we'll stick your arms up, and we'll do your biceps, triceps, and push back out now. Can you pull in? Okay. Resisting against everything. Just to make sure, can you stick your elbows out again? And then flex, extend, and then pronate, and then supinate. Okay. Flex, extend. Yep. Okay, that's all good. Now we're gonna do your wrists. So just flex them, extend them, and rotate. You do all that again. Okay, can you open and close your fingers and spread them and close them? Close them again. And we'll do your hips, so kick out, kick back on both legs. And can you extend and flex and rotate? Okay, so just kick out with this leg. We'll just do, yeah, flex, extend, back, abduction, adduction, rotate. Same thing with this leg. So here, kick out, bring it back in, kick out, gives against resistance. So let's build these things together, kick out, push back, and kick out again. Can you see me hold this thing then? Now you can sit back. Lift up here. Can you kick your knees out? I'm going to use this inspection note for your hamstrings and quads and stuff like that. Okay, next, just out against resistance, pull back. Yep, that's right. Then kick out again, and then pull back again. Okay, all that's normal. Can you flex your toes up for plantar or dorsiflexion, then plantar flexion, inversion, eversion? Yep, we'll go through all those again. Okay, you can sit back down. Or lay back down. Everything was a 5. There are no joints, range impairments at the moment. I'm going to put you in a comfortable position, which you are in. You're comfortable. Do you have any concerns?
Nope.
That's all for today. I'm going to lower and lock your bed. Fall risk, call light. I'm going to give you your table. I'm going to have to do my hand hygiene. I'll also chart. And I'm going to start with cleansing my equipment. Follow me around. Make sure I see I'm cleansing my equipment. Everything that was used, and I already cleansed that. Here, follow me again. And then I'll just hand hygiene. Okay, and that should be it for today.